Hey, everybody, welcome to the Untrivial Podcast. Today I have with me Dr. Madeleine Clark. She is a naturopathic doctor with a clinical focus in women's health, and she is also the co owner of Crafted Balance Naturopathic Clinic. She truly believes that no symptom or circumstance should get in the way of a woman pursuing their dreams and honors the human side within medicine. Today, we discuss the difference between naturopathic and medical approaches to well being, myths and misunderstandings surrounding naturopathy, Madeleine's five-pillar approach to health, common women's health issues that women are looking to address. We also discuss hormones, changes to our bodies as we age, social media's influence on wellness, and so much more. A reminder, this is not medical advice. Please talk to your primary healthcare provider before starting any wellness protocols. Lastly, if you enjoyed this episode, please leave a 5-star review or share with a friend. It will really help me reach more listeners and share these insights more broadly. And with that, let's get into the episode. Dr. Madeleine Clark, thank you so much for being here today. How are you?
I'm good. Thank you so much for having me.
Amazing. Well, I'm so excited to talk to you today about all things naturopathic medicine and women's health. But let's start by just hearing a little bit about your background and what you do today.
Yeah, definitely. So I got into naturopathic medicine after my undergraduate degree at the University of Toronto in life science. I took a course there on complementary and integrative medicine. Um, from there, I went to school to become a naturopath. And currently, I co-own a women's focused health clinic in the West End of Toronto with a variety of different practitioners, but we primarily focus on women's health and supporting them with naturopathic medicine.
Amazing. That is so cool. How would you personally describe the difference between a naturopathic approach to medicine versus maybe a more medicalized or MD's approach to medicine?
Yeah, definitely. I would say naturopathic medicine, also just because of the nature of kind of private healthcare, we have the time to really dig into a lot of the issues that might be going on for somebody. In the traditional OHIP system, it can be a little bit like symptom management. Like you come in, you have one kind of concern, whereas in naturopathic medicine, we have the time to address the top 5 concerns, which actually might be related. So we kind of definitely take that more holistic approach. And even when we're talking about strategies to help manage that, yes, there's some symptom management in there, but there's also looking at like lifestyle in general and seeing how we can improve things
Mhm.
in combination.
Yeah, great. And then in terms of like the protocols or maybe the recommendations that you provide patients, is it right for me to assume there's probably more of a range since it's likely not just medication or surgery? Like, is it broader in terms of the solutions you offer?
Yeah, absolutely. So it definitely all depends on, the patient that's coming in and even what they're ready for. Some patients are very gung ho and, ready to take on like multiple recommendations, and others need to start a little bit slower, which, we chat with them. And we kind of gauge it to whatever makes sense for whatever they're able to take on. There's usually always an element of a lifestyle recommendation, which sometimes can be the hardest part.
Mm,
Even when they sound simple, it's hard to change your habits. It might include supplement recommendations. And, at the odd time, we are sending them back to their medical providers for something like medication or surgery, and just helping them understand why that's their best option.
mhm.
And, an education around like what is available and like what will be the most effective for them.
Yeah. I so appreciate that as well, like saying that you could recommend them back to a medical doctor because, it's not one or the other. And I think a lot of people, myself included, like I just did what my parents told me when I was growing up. It was like I didn't have options in terms of what type of healthcare provider I wanted to utilize. Like we just went to the family doctor. And I think as we get a little bit older and more independent, we can start exploring those different avenues and opportunities. But, you know, what I've realized is that's like one tool in a toolkit, and naturopathic medicine might be another, therapy might be another. And there's actually such a broad range of services that we can utilize to improve our well-being and physical and mental health.
Yeah, absolutely. And I think sometimes, like, again, with just the time that we can take with patients, some patients are okay with, eventually going down the road of what their MD has offered, but they're curious and they want to know why, and they
Mm,
want more kind of explanation around it. Which, unfortunately, like, OHIP's a great system in that, it's accessible. But unfortunately, patients just don't get that time sometimes when they hear a diagnosis and then they're like, I don't know what this means. And I don't know what my options are. We're at least there that, yes, we can, discuss all the other options within naturopathic medicine, but even just take the time to help them understand what's going on and why they're getting those recommendations.
mhm.
Even if that is and ends up being the best one for them, or helping them control, like, from the lifestyle supplement, what you actually can do alongside that.
Yeah, absolutely. And for people who don't know, OHIP is like our Ontario-based healthcare system. It is not private; it's public, and there definitely are a lot of positives to that. And as Maddie, as you're saying, there's a couple of drawbacks, but I totally agree. It feels like almost like an assembly line of patients. You're in, you're out. You've got 5 seconds to kind of talk through what you need, and they might write you a script and send you on your way. But it definitely doesn't feel um, as personal or as intensive as maybe some people need or want in that moment.
Yeah, yeah, and that's the feedback sometimes we get from a lot of our patients undergoing, like, concerns within women's health too,
Mm-hmm.
especially, like, in the fertility world, that way of just, like, sometimes they're just looking for, like, a little bit more support,
Mm-hmm.
and again, like you said, like, the system is great in that it's accessible for everyone, but people just, I think, are looking for a little bit more care
Yeah,
sometimes.
absolutely. I've also heard some people say, and you can tell me if it's true or not, but MDs sometimes cure symptoms, but not root causes. What are your thoughts on that? And what might be like a naturopath's approach?
Yeah, yeah. I think sometimes that can be like the interpretation when people are giving like a medication for their symptoms and they're like, but I don't feel like I'm addressing,
Mm,
yeah, like that root problem. And depending on the concern that's going on, like, do we always like quote unquote cure the root problem? Maybe not. But we can definitely manage it with our lifestyle a lot more. And I think people feel better about that than just feeling like, oh, I'm taking a medication that, yes, like, works for the symptoms, which sometimes I'm talking to patients about, like, I mean, that's great if the symptom is annoying,
mhm.
but they feel better about, like, taking that whole, like, holistic approach to kind of manage everything versus just symptom. And then they feel like, I'm not addressing like anything else.
Right. I think I'm definitely in the camp of people who maybe again, I wasn't exposed to naturopathic medicine growing up, and I've only just started kind of getting curious about the space as I'm approaching, my 30s, but it sounded a little bit woo-woo to me when I was younger, but what do you think people misunderstand or get wrong about naturopathic medicine? Is there any, like, myths that you wanna debunk?
Yeah, yeah, that's a good question because I mean, I actually had the exact same approach towards naturopathic medicine when I took a course at U of T about it. I honestly was like, "Oh, the university is just gonna like tear this apart." And then through the course, I found like, oh, when we talk about prevention, like of chronic disease and that kind of thing, it's so cost efficient. It's actually so beneficial for people. And I think sometimes the myths around naturopathic medicine, especially from the past, are that, it's not evidence based or it's like very traditional, like kind of granola side of things. Which of course there's like elements of that and it depends on who you're working with
Mm,
too. Um, but I think people understanding that, we're not like anti like the medical field,
right.
or, yeah, not anti that, not like, you know, pulling things out of thin air to like say like we're going to cure all of this. Like the field is definitely going a lot more into an evidence base, and a lot of practitioners pride themselves on being that way.
Mhm.
So I think, you know, debunking the idea that you're going to walk in and like hold a crystal or something, and I'm going to tell you like what allergies you have. Like that's not like the modern naturopathic medicine.
Yeah.
Um, yeah. And it's not all about like cutting foods out and, you know, it, being really restrictive or something too, which I think is something that can come up a lot. And, I openly talk about that with my patient when we talk about food of like, look, like, I don't want you to leave ever feeling that way. So let's
Mhm.
uh, put that top of mind when we start getting into these conversations.
Right. So, what is your approach or your philosophy when it comes to wellness or health that you execute and share with your patients?
Yeah. I like to say to my patients, like, we started the clinic to kind of honor the human side of us in what can be a really intense wellness world. So that's kind of the approach I take towards every patient visit. I always say, you're in the driver's seat. Like, if I'm making a recommendation and it's going through your head that like you're not going to do it, just let me know. Because that's where we get sustainable change from. So sometimes that also opens the conversation around like coaching. Like, if we're going to make a shift in lifestyle, like, how do we make that like doable for you? It's not just, here's a list of recommendations. See ya.
Right.
Um, we approach it that way. And then the other side, which I kind of touched on, was I really care about using evidence based medicine and research based approaches, and also being really transparent about what has research, what doesn't, with my patients.
Mhm. You also talk a little bit about 5 pillars of health. Can you break down what those are for us?
Yeah, yeah. That's kind of how I get into chatting about lifestyle with my patients. So I like to always say naturopathic medicine at its foundation is, based in lifestyle, and I break them up into 5 pillars of health. So the first one is eat. So I always say, yes, it's our diet, but also our relationship with food.
Mhm.
The second one is movement. So how we like to move our bodies, exercise. Think is the pillar that's all about mental health, stress management, outlook. Rest is, yes, sleep, but also how we take a break, how we have fun, how we recover. And then connect is the pillar that's about our relationship with ourselves and others.
Mm.
So sometimes, we're patients are doing well in those pillars and we're just like providing resources or goal setting. But every plan involves like touching base on like some of those and how they're going.
Yeah. And I think that's such a good point because, experiences in all of those pillars impact everything. Like our diet impacts our mood, our sleep impacts our mood, our, rest impacts our, health and well-being as well. And I think sometimes people forget how interconnected everything is, or they want like a singular fix or a one-stop shop, but you can actually make such strides for your well-being if you're just looking at even those in isolation, but more so when they're all put together too. That's so cool.
Yeah, yeah, absolutely. And that's why, I always include that too, because it's kind of this same idea, like with, if you pile on a bunch of supplements, it's not going to fix the fact that someone sleeps 4 hours a
Yeah.
night, like it's like, so that's kind of where we're going to see the most change. And like, if we can maybe give them something to help them sleep, or give them some tools to like even get to like 6 hours of sleep, they'll feel better. But, um, we're not going to fix everything with giving a bunch of supplements. Like, we're really going to fix things by like, uh, touching on those lifestyle pieces, and also turning them into lifelong habits for people.
Mhm. Do you think any are more important than the others, or are they all kind of equally super important for everybody?
That's a good question. I would say they're all equally important, because I think you can really, see. I've seen patients across the board where it's like they might have all four of them, going well, but then their relationship with themselves or like their friendship groups or something like that isn't there, and it does deeply impact their health.
Mm.
And same with, the sleep or diet. Like, I think you can sometimes get away with one for longer, but you ultimately end up like seeing it. And after you see patients for a long time, like, you'll like they'll come up with or come in with a symptom, and then once you kind of dig into it, you're like, oh, okay, like this probably needs to change.
Right, right. Let's talk a little bit about women's health because I know obviously you own a women's health clinic. And, I personally feel like it hasn't been a main focus for a very long time. Like, for example, I literally, like in the last year, just learned what the luteal phase was in your cycle. And it's like there's so much information about our bodies that maybe we haven't had access to or awareness of. So like what are your thoughts on kind of women's health being a main focus?
Yeah, I actually love working in women's health, and I never thought I would. But it is really fun, and it's a great time in like research as well. Because for the past like 20 years we weren't really like researching women.
Wild.
And now yeah,
Outrageous.
and now fortunately yeah, really. And now fortunately we are finally. So that's kind of cool because we're learning so much more in like, in women athletes versus like we used to just take research from male athletes and like apply it to women, and it's like our bodies don't work the same as them. And then obviously like we're learning a lot more about fertility and pregnancy, and then perimenopause, and the menopause transition, and just like
Mhm.
options for people because traditionally, if there's like a hormonal issue going on, a lot of the time the management is using like a birth control, which works for some things and also works when you want contraception. But for a lot of people, they're just looking for more options, and that's actually the space where naturopathic medicine works really well,
Mm.
to kind of help people. And women are very curious about their health too, and they want to know more
Mhm.
and they want to learn more. So it's a fun space to work in because there's a lot going on, like just yes, in hormones, but then also women, experience a lot more like mental health concerns, proportional to men, and digestive concerns, and like also these things all start to overlap too.
Mm.
So it's interesting to be able to kind of chat with them about all of those things across the board versus like we were kind of saying before, when you get sent to a specialist to talk about digestion, and then a mental health support to talk about mental health, and they actually might be overlapping.
Right. You brought up birth control there for a second, and I read a book recently. It's by Dr. Sarah Hill, and it's called like Your Brain on Birth Control. And it is so wild that we are allowed to take birth control, and it's like so common. It's like the contraception, like the pill and all the hormones that it pumps into us, but it actually has so many, you know, insane effects that maybe aren't what we wanted to get out of it. I guess a question are they like developing more options right now, or like do we have any more options?
Yeah, that's a good question. I mean, there's lots of different, and I'm not a prescriber of birth control, but there are a lot of different options within kind of choices around it.
Mhm.
And I think that also goes back to the like people are lacking, like they feel like, okay, I end up on this medication and I never had like a full conversation about
Yeah.
it. And maybe I would be okay with that, if I had had the full conversation about what does this mean? What does it do for me? What are the risks associated?
Mhm.
And again, that's a time thing, because birth control did like revolutionize women's
Yeah.
lives. And at the same time, I think a lot of them have a lot of questions about it and kind of what it's doing for them, what it's done for them, what other options they have.
Yeah, definitely. And then you brought up that digestive issues or and some mental health issues impact women more so than men. Can we talk about that?
Yeah. So I'm mainly thinking about like when I say that, I'm mainly thinking about like irritable bowel syndrome or IBS.
Mm.
We just see it impacting women more often, which is always really interesting. And it's often very tied to stress, anxiety, mental health concerns.
Oh, why do you think
Mhm.
it's impacting women more?
I think because they're also impacted by depression and anxiety more.
Oh, oh,
Yeah.
sucks for us.
Yeah. 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 I don't know if there's like there might be more kind of information on like, why it's gender specific, but I think from my understanding, I think it just comes down to the fact that women experience more like anxiety and
Mhm.
depression. Um, and typically there's an element of that, in usually in an IBS case.
Yeah. I think, like, on average, 2 women are just, like, more neurotic in terms of, like, the f big 5, like, personality traits, like, neuroticism is one, and, like, women are very often higher in that trait than men, so that totally makes sense. Um,
Yeah. Yeah, exactly.
what are the most maybe some of the most common things you're talking about with patients today? Like, what's coming up a lot for you in your clinic with women?
Yeah. I would say we do a lot of skin. So a lot of like acne,
Mm.
eczema, psoriasis. But we also do, like I said, like a lot of mental health, a lot of energy, which is always interesting to dig into with patients when they're feeling low energy. And then in terms of the kind of hormonal side of things, it depends on like what stage someone's in their life.
Hmm.
So that might look like, fertility concerns, irregular periods, painful periods, PMS, or like more of even the kind of like mental health side of things before their period. And then uh, we're starting to see a lot more perimenopause, menopause,
Mm.
and kind of the changes that your body can take you on there, which can be like physical, mental, um, as well as you starting to think about, okay, my future as I age, what does that look like? Cardiovascular risk, bone health, uh, that sort of thing. And then, of course, digestive issues. We do a lot of bloating, like, just like painful
Mm.
digestion, irregular digestion, and supporting people that way.
Yeah. Yeah, that's I have like all of those concerns. And I will.
You're not alone.
Yeah. Oh, that's good to know. Um, you talked about energy, which I think is cool because I don't think I've ever gone to the doctor to be like, I'm so tired, but I am. And I think a lot of women are so tired. So, like, what do those conversations look like? And maybe what are some recommendations that you would give to someone who's feeling low energy or lethargic on a day to day basis?
Yeah, usually that kind of conversation starts with just kind of like asking about like what the energy looks like throughout the day.
Mm,
If there's any like peaks or valleys. We always want to talk about sleep because it seems intuitive, but sometimes people don't connect their poor sleep with
right.
their energy levels. So, just making sure that they're getting like good quality rest. Uh, then, if you're feeling low energy, it's like usually I'm always recommending like some form of basic blood work, especially if you have a regular period, just making sure your iron's in a good place. Because I always say to patients, it's like, we can dig into, if stress or sleep or any of these things are contributing, but if you're low iron, like that's an easy fix.
Mm,
And we don't want to overlook something like that. So usually like energy involves like some kind of routine blood work in that way, just to make sure we're not missing anything. And then if all of that is normal, sometimes it does get into a conversation around like stress and burnout and mental health. Low energy is funny because it can show up as a lot of different things. So, like I said, it could be the sleep, it could be, a nutrient kind of status thing.
mhm,
And then it also can be mood and low mood. So,
right.
kind of touching on all of those things. And then some people are just like doing, especially women, doing too much and they just run out of steam. And it ends up being a conversation of like, okay, how can we, maybe scale back, or like what is not serving you?
Mhm,
Um,
got it. And you talked a little bit about acne there as well. I feel like we were sold a lie that you would only have acne when you're like a teenager, and it's outrageous. like like do you see a lot of women in their 20s, 30s, 40s who are still experiencing acne? And like why? Why is this still happening to us?
Yeah, yeah, absolutely. There's a few different reasons. Like sometimes it can be hormonal. So either like around your period,
Mhm.
or if you have a concern like polycystic ovarian syndrome, where like that has an element of elevated testosterone,
Okay.
which sometimes people don't know they have until, they're 27 and they decide to come off the pill.
Okay.
And suddenly it's like, oh, like I have acne and irregular periods now.
Mm.
So that's often like a space that we're kind of working in. And then acne is a tricky one too, because you're always kind of just trying to manage it. You're never like quote unquote curing your acne.
Right.
So that might involve like kind of looking at, like how is stress impacting? How is sleep? How is diet? How is all of those things? It's funny because when people come in with acne, like we do talk about things they use on their face, but I don't typically change it because I'm like, if you've had acne, like you've figured out what works for your skin,
Right.
you've experimented with topical products. I'm not going to change that.
Okay. So you focus on kind of like the inside and changing things behaviorally or diet wise.
Yeah. Yeah.
Oh.
More often than not, unless somebody is using like really harsh stuff on their face,
Mhm.
we might like switch it up a little bit. But I find most people know what works with their skin. So we're just doing kind of everything else. Like, what can we do from a hormonal perspective? What can we do? from a diet perspective and all those lifestyle sides of things.
Yeah. Yeah. On the topic of fertility, I have a bone to pick with our system, and you can tell me if it's only in Ontario or if this is kind of a North America issue or a Canada issue. But I'm really frustrated by the fact that a lot of women, at least where we are, can't explore or uncover their fertility, risks or, how well they're doing in that space until they've already been trying to have a baby for a year. And it's like you can't even start understanding what you might want to change or do differently, or if you're at risk or you need to start trying earlier until, in my mind, like it's almost too late for a lot of people if they get to that stage when they're like 33, 34, and maybe they just then uncover that their window for conceiving is shorter or smaller. And I'm just curious what your thoughts are around that, or if that's something you maybe don't recommend if people come in curious about their fertility. Like, can they explore that earlier?
Yeah, that's a good question because I feel like it's so interesting because I feel like it's holding the balance of like, yes, sometimes we can get this information,
Hmm.
and at the same time, like stuff in medicine and like even like testing and that kind of thing is not like ever absolute,
Right.
right? So we have patients that, or in research that it looks like on paper, like there's no way that they're going to have a child, and then they do,
Yeah.
and vice versa. There's nothing wrong, and then they're having a hard time.
Mm.
So it's a little bit like I feel like holding that of like you can explore and like, they obviously like limit who can kind of access everything because I think a lot of people are curious.
Mhm.
And sometimes it's like, is it going to change your decision right now? Is when we have patients
Right.
coming in and they want to, they like, especially if you go private, you can run that blood work, you can explore, you can look at it, but is it going to change what you're doing right now?
Mhm.
And is it going to be anxiety inducing? Sometimes like there's that
True.
delicate information of like, or balance of like too much info and what you want to do. But I do agree. Like I think again, this goes back to like people are very curious about their
Mhm.
health and they don't have like an opportunity to kind of sit and explore and like ask those questions too of like, well, if I run my AMH as a measure that kind of tells us like how many eggs. So it's, a lot of times like it can be used as like your fertile age
Right.
sort of thing. And, AMH can also change. People with low AMH for their age can still get pregnant. So
Mm.
it's just like taking into account like all the nuances of it and then deciding like, do you want to do that?
Yeah. So maybe, yeah, you need to be in a place where, maybe you have a partner, it would change your plan and how you would approach, conception with them or something like that. You're right about the
Yeah.
anxiety. I think that would bring a lot of people a lot of worry, but I definitely believe like the more information the better, but I think some people feel differently. Um
Yeah,
but
yeah. And not to say that like, it's still at the end of the day, it should be someone's choice. It's how much they want to explore.
right.
But I think just also like understanding all of that. And if, everything comes back and you still want to like proceed with uh like egg freezing or embryo freezing or something like that, like there are starting to be like private kind of options and we see patients doing that. So
Mhm.
it is nice that like at least like, in this day and age, like that is something that's on the table versus,
Yeah.
30 years ago.
Yeah, totally. Do you see more people moving towards freezing their eggs nowadays than maybe in previous years?
Sometimes it's still not a huge thing we kind of
Okay.
see. But like there are patients who are exploring that. So we're just kind of supporting them in the best way we can with the lifestyle things, if that's their choice.
Right. What is perimenopause? You mentioned that. I don't even
Oh,
know what that is.
yeah, good question. So perimenopause is actually like the 7 to 10 years before menopause.
Okay.
So menopause technically is like when you're a woman who's aging and you stop having a regular period for a year, then you're considered to have entered menopause.
Okay.
But 7 to 10 years before that, your estrogen is fluctuating all over the place as it like ultimately is starting to decline,
Mm.
which can result in a whole kind of slew of like, I think we think of them often as menopause
Mhm.
symptoms, but a lot of symptoms that may include like hot flashes, mood changes, body composition changes, vaginal atrophy. So there's like a drying and like your changes to the vagina that happens that can cause like pain and
Mm.
discomfort. I'm trying to think of more symptoms off the top of my head, but it shows up in a variety of kind of different ways. And yeah, there's not a like traditionally there hasn't been like a lot of options, or one of the big ones now is hormone therapy,
Mhm.
which can be really helpful for people. And again, can be one that, it has a scary bit of a scary past in the news and stuff,
Mm.
but can actually be really helpful. And uh, patients are on board with it when they
Mhm.
they have a whole conversation about where the research actually sits and the risks and that sort of stuff.
What do you mean by that? Like it has a scary past. And what is the hormone therapy? Would it be like taking estrogen?
Yeah, so hormone therapy is usually like some combination of taking estrogen or progesterone,
Okay.
either orally or transdermal, so like on the
Mhm.
skin. And years ago, there were big studies that showed there might have been an increase in breast cancer with hormone therapy and
Oh.
other kind of concerns. But now, like looking back on that research and how they conducted it, and then current research that we have now, it's actually a lot for it depends on the person, of course, but maybe a lot safer for a lot of people than we once realized, and beneficial because when people are going through that time and it's like, cool, I have 10 years of these like debilitating hot flashes and
Yeah.
insomnia, and I'm grumpy all the time and I like can't sleep. It's like they need options, you
Mhm.
know? So depending on the person, I think the risks that we like originally once thought were associated with it, we've learned a lot basically
Gotcha.
since then. So it's actually a lot for the right person, a lot safer than we maybe once thought.
Okay. And so when you can expect potentially someone entering that phase of perimenopause, is that like mid 40s, early 40s, late 30s?
Yeah, that's a good question. It really depends. So I think a lot of the times patients will look at their moms and see their kind of perimenopause, menopause experience and think like, I am destined for that either at the same age or the same like intensity, which it's actually not as genetically linked as we think. So a lot of things are less genetically linked than we think. So we're not like destined for whatever our family members had.
Mm.
So it depends. I think the average age that people enter menopause is around 51. So that could mean that, you're looking at like early 40s seeing some of these changes. Um, for some people, it's earlier. For some people, it's later. For some people, the transition is very like smooth, like they don't have a lot of symptoms. For other people, it's awful. Um, so it all kind of just depends. And yeah, it's an interesting time because in that time, people can still have children too. So you're kind of
Oh,
trying to figure out depending on their age and their goals and what they're going through. Like, okay, what are we using here?
yeah. For younger women, maybe in their 20s and 30s, is there something that you would note that maybe people aren't paying enough attention to or should be paying more attention to when it comes to their health?
Yeah, that's a good question. So with our younger kind of population of patients, it's usually like one of the things we're always trying to hammer home is actually like that's the time where, or like before 35, that's your time to like build your bone density.
Okay.
Um,
Huh.
Yeah. So because after that, like you're not really like building up as much. So that's one of the things like we're kind of always talking to with the younger patients of just like making sure you're doing like weight bearing activity when you're younger. So that could be like something like running or anything that you're kind of like pounding, but also strength training
Oh,
makes a big difference. And those are like your years to build up as much as you can because after that, you're just kind of trying not to lose bone density
right.
and muscle mass. So that's usually a conversation that of like kind of usually everyone's doing everything else like really well,
Mhm.
and then we're like, okay, but like strength training and that kind of thing. And the other conversation we have with a lot of our younger women is just like making sure they're eating regularly and maybe eating more than they think. I forgot to say that in the energy piece.
Mm.
Sometimes it's like we're all those things I discussed around like why someone has low energy and then they're only eating like one meal a day.
Yeah.
Well, you're gonna feel tired if you're not having breakfast, you know?
Yeah, definitely. Okay, so building bone density, that comes from like, working out, strength training. running, you said. Any others?
Yeah. Anything that you're basically just like pounding kind of on ground. So it can come from sport, that sort of thing,
Okay.
but something more like swimming or biking, like you wouldn't have the uh same like pressure on your
Oh,
bones. Yeah.
okay.
And then strength training because your muscles, when you're like, doing a workout with something weight bearing, like pull on your bone a bit. So it's all just like you're kind of almost like micro injuring the bone, and then that causes it to like kind of
Oh.
recover itself and make them stronger.
Oh, I thought running was, like, bad for your, like, knees or bones. I've been misled.
Yeah.
But walking wouldn't do
Yeah.
the same thing. It's, like, too gentle for, like, bone density building?
It still would probably help, but like definitely the gold standard number one thing would be lifting weights.
Okay, gotcha. Okay, cool. So bone density is something we all need to pay attention to. And then you said before the age 35, so it starts to decline kind of after your mid 30s?
Yeah, and so does muscle mass. So it's like definitely not. I feel like when we're younger, like it's not a sexy topic. Like no
No.
one's like, oh yeah, I'm doing my weight training for like my bone density when I'm like 70, right? But then you like when you see it later, people were struggling with like osteoporosis. It's it's tough because like you don't have a lot of options when you get to that age.
Right.
And it's something that's very associated with like your ability to live independently, uh, and like not have to be worried about falls and
Mm,
and that kind of thing that can like um really kind of change your life, how you live as a 7-year old. And unfortunately, like at that point it's like there's medication options, but like from the lifestyle side of things, like we're just trying to maintain and it's almost like a little bit too late
right.
to do anything different. That's why it's like I talked about it with young women, trying to get them excited about it. Like I said, even though it's like
Woo!
not sexy.
Yeah.
Yeah.
Yeah. This is like a random off-topic question, but I've seen it a lot on Instagram right now, and it's like mouth taping for when you sleep, saying that that's super beneficial for you in some ways. Is that true? Do you know anything about that?
That's a good question. I've never looked into the research on
Okay.
it, so I like honestly can't say either way. Um, I feel like if there was enough to say like, oh, this is the most like best thing you could do for sleep, like we'd hear more about it
Mm,
from like, it'd be more established. But that's not to say that like sometimes when things come out and they're like newer, research follows it
right.
later. Um, but it's probably like if you want to do it, if it does bug you, great. But if you don't, like probably just getting good quality sleep is the best way.
Okay, cool. And I think that that's actually kind of something of note. Like, so much education, so much of what I learn about health or wellness right now is coming from the internet, obviously, and social media, which I think can be like a double edged sword because, as much good information is out there, there's also a lot of information that isn't so good. What are your thoughts on people who are coming to you, who maybe saw something on TikTok and that's kind of their basis for wanting some sort of treatment or protocol?
Yeah, that's a good question. And you know what? I actually don't mind when patients come in and have those questions from TikTok or social media. I joke that I'm constantly like battling it. But it's I think it's a beneficial thing to come into a visit and say, like, you know what, I wanted to talk to somebody about this before I went and did it.
Right.
Because that is my job. Like I look at the research on supplements and wellness things to say, like, is this something that you should stress about adding to your day or not yet, not really. And like I say that to patients, like if a ton of research comes out on this, I will eat my shoe and prescribe it to everyone. But right now, I don't think we need to worry too much about it unless like it's just something you enjoy. But I think that's like social media is great because it creates like dialogue around a lot of things and gives
Mhm.
people access to information. And then I think it's also at the same time like just taking a critical eye and like understanding where you're getting your information
Yeah.
from. Also, does that necessarily apply to you?
Right.
So sometimes we can be talking about like research, but you're not actually that kind of target patient with those concerns. So it's nice, to be able to come to like more of an objective source who looks at it. And I say that to patients. I'm like, I have an accountant for our business because I don't understand HST. So I ask him all those questions and then, let me answer these questions for you. Because I think just understanding that, yeah, there's a lot out there and And it is daunting to wade through it all.
Yeah, absolutely. I love that. It's like, it's not a no. It's not, don't pay attention to it whatsoever, but it's maybe double check with a healthcare provider if it's something that would work for you or would be beneficial for you specifically, because everybody is so different. Every body is so unique. Everyone's needs are so different. And I feel like sometimes I'm a little bit bothered by that when people kind of go in deep about like their personal like health protocols for themselves. And it's
Mhm.
like, you also have to remember that there's people out there who are just going to copy you. If you're influential, they might just do what you do and it might not be the best thing. So yeah, I love like, let's explore it. Let's be curious, but validate with someone who knows you and knows your body and your needs.
Yeah, exactly. And I think like sometimes in this kind of complementary integrative world and like wellness world, it can feel like nothing's harmful because it's all natural.
Mm,
And it's like, well, there's like way more nuance to that. Like supplements and herbs can interact with medications.
yeah.
If you take too much of something, it can, have a side effect. Even around diet and stuff, like when people are doing specific things, it's like, it can be challenging to follow. It can like change what like actually you need to feel good. Or it can also bring up like something if you have a past of struggling with eating or restricted eating or something. And it's like you need to also remember like to focus on like what works for you.
Mhm.
And yeah, it's I think sometimes like in an effort to kind of share things and like help others. Like we have wellness like influencers.
Mhm.
That's like actually like the best thing you can do for somebody else is like send them to a healthcare provider
Yeah.
versus just saying like this is what worked for me. Like that's fantastic that they're doing better, but that doesn't necessarily mean that we copy and paste that to everyone.
Yeah. Absolutely. Do you have any advice for women who maybe haven't taken a step into the naturopathy world and might be curious about learning more, but don't know where to start or don't even know what issues they could come to you with? Like, what is your advice for women who might be in that
Yeah.
situation?
Yeah, definitely. I would say if you're interested in it and you're not sure if it like applies to you, like most naturopathic doctors offer complimentary meet and greets.
Hmm.
And it's a great option to just like free appointment, book, have like a phone call to kind of chat about like, here's why I'm interested. I have sometimes those meet and greets where people are like, I don't have a specific concern, but I just thought I like kind of wanted to do this. And it's like that's also a good
Yeah.
reason to book into because we'll just go over everything that you're doing in your health, any supplements that you're maybe taking. And sometimes I'm like, stop this, continue that, don't need to worry about these kind of things. It's just like a check in, but I would say definitely take advantage if you're interested in that of a meet and greet appointment to make sure that the person's the right fit for you before you kind of commit to like going into an initial appointment. And as the naturopath too, it's like it's a great option for me to be like, okay, great, like myself and this person are going to work well together. Or if there's something specific that they want, like I'm happy to refer just so that person gets the care that they're looking for.
Yeah. Do you have a lot of people coming into those calls who are coming from maybe a medical doctor and they're like, we've tried everything, this hasn't worked? Maybe they've gone to a dermatologist and, whatever topical lotions they've given them for their acne just like aren't doing the job. Like, do you encounter a lot of people who are kind of frustrated at maybe more traditional doctors?
Yeah, sometimes, and sometimes it's even like their doctor is saying, why don't you talk to a naturopath
Right.
about this? Because I think sometimes when things are like also tricky and MDs have done everything they can, they're like, go to the naturopath, see what they can do. And in those situations, like it's not necessarily like if it's something that's a little bit like everyone's kind of puzzled by it. It's not like I necessarily like am like I have the cure,
Mm,
but usually I take it as like if we just improve your health overall, like maybe you'll feel better. But that definitely does happen where someone's like, I just, I'm frustrated by the answers that I'm getting, depending on who they've been working with.
mhm.
And they're just looking for either more options to go alongside with what they're doing with their MD, or again, back to that, like, I don't understand why they've only given me these
Yeah.
options. So I'm kind of looking for more like explanations and just like things I can do too.
Yeah. Do you have people who prefer not taking like medication in particular, like they want only natural options? Is that a clientele that you deal with?
Sometimes, and it depends on kind of like the medication we're talking about. So I have patients who have a preference to not take like painkillers for period pain,
Right, right.
and go that way. I'm not anti-medication at all. I think, there's some circumstances where it is the best option, and I'm, telling the patient like, no, you're not coming off of this, and like because it's the best option, or like you should go back to your MD.
Mhm.
But there's definitely like still that patient population that's just looking for like a more quote unquote like natural way to manage things. Either if that's like using a supplement to cut down, like I said, on like painkiller use, or trying to manage things with lifestyle. But it's certainly, depending on who you are, coming off of medication isn't necessarily always an option,
Mhm.
but we can always work alongside it.
Yeah. What, if anything, from this episode do you want people to just take away about naturopathic medicine? If there's one kind of grain you can leave everyone with.
Yeah, that's a good question. I would say, just if you're curious about it, or curious about kind of lifestyle, to definitely explore it, and recognize too that it's not, like we were kind of saying around the myths, like it's not just like tons of supplements and testing and all of that kind of stuff. Like it can be really an approach where we're looking at your lifestyle and optimizing your health and trying to find like sustainable ways for you to maintain that like your whole life. So sometimes that's also, a conversation of like, okay, we're making these changes, but this isn't like you do this for 3 months and then we stop doing it. It's like we're
Mhm.
thinking like, how do we put this in place for like 10 years,
Right.
or the rest of time, for your health and what works. So it is very individualized in that way. And like not every patient is the same in terms of what they come in and what they want to do for exercise. So we're really like personalizing it to what their routine is like, what their lifestyle is like, and what they also just enjoy.
Right. Last question. Where can people find out more about you? Where can people get in contact with you?
Yeah. So our website is www.craftedbalanceclinic.com. Crafted Balance Naturopathic Clinic is our clinic located at Dundas and Dovercourt. So you can find us online, and we have a blog there and our online booking. We also have an Instagram account, Crafted Balance Clinic, as well as I have an Instagram account, Dr. Mad ND. So any of those kind of avenues are ways that you can contact us and find out more.
Madeline, thank you so much.
Thank you. This is fun.
Hey, everybody. Welcome to today's solo moment. I hope you all enjoyed the episode with Dr. Madeleine Clark. I wanted to talk a little bit today just about the fitness world, specifically for women. I know today we were talking all about women's health, and it kind of got me thinking about how historically kind of fitness and wellness has been marketed to women. And so conventionally, it feels like we've been sold this like quote unquote fitness light movement that won't make you bulky, won't make you too manly, practices that have been aimed at really sizing down more than anything else. And exercise, sadly, for a lot of people, is really only has only been positioned to them as a weight loss tool and not as much as a tool for the so many reasons it's actually amazing for us overall. Improved sleep, better mental health, better brain health, strength over the lifespan. Like there's so many reasons that exercising and moving our bodies are great for us other than its impact on our size. And I feel like we haven't necessarily been taught that over time. And I think it's gotten a lot better in recent years. And it's improving with social media and just like our knowledge sharing and all of that. I think a lot of us are still trying to unlearn a lot of those things that we were taught growing up, or for older generations, what they learned basically throughout their entire lives until very recently. Things like walking, swimming, aerobics, they're all great. But I still think strength training for a lot of women, not all, but a lot, is still something that is quite intimidating. And so, you know, people get into these habits, and especially myself when I was younger, of just sticking to what I know, exercise classes that I know, or modalities that are more traditionally female oriented. So you're kind of in that comfort space of like women peers, things like Pilates or bar. It's a lot of women in those classes, and those are great exercises. Um, but I wanted to talk a little bit about maybe moving into spaces that you might be not super comfortable with, but are still going to be really, really beneficial for you for so many different reasons. So, you know, I'm super happy that in the last decade, we've had so many more female influencers and individuals who are now in the wellness space who do, you know, every type of exercise under the sun, CrossFit, strength training, jujitsu, like all of this stuff that maybe has historically been more male dominated or male oriented. I'm seeing a lot of women enter these spaces, and it's just so good for us. I don't think we should be limited to a particular type of exercise, especially if you like different types of exercises and you just have been a little bit nervous to try or you think you would really enjoy. So, if you want to make your way into this space of weight training, I wanted to just give you a few recommendations or options that you can try if it is something that you still feel quite intimidated by. Number one, there are so many great apps that you can use and do at home. Apps that include a lot of weight training pieces to them. So, one, for example, is the Sweat app. I personally have that. It's by Kayla Signs. I don't think I ever say her name properly. She's an Australian fitness individual, and she created this app with so many different trainers that lays out so many different types of workout plans, and a lot of them do involve straight training. And so, if you're the type of person who has a set of dumbbells or two sets of dumbbells at home, maybe has a yoga mat at home, this is a really easy, non intimidating way just to get into those types of exercises using equipment at home in kind of that space of your own comfort, just to get yourself trying it, getting familiar with the movements, getting comfortable doing those types of exercises. The other option is to go to a class that has a weight training component. So, Barry's Boot Camp, for example, is one that I love and go to. So, it's like half running, half strength training. So, you do treadmill for half the class, and I think Orange Theory is very similar, but a class that does have those pieces to it as opposed to something that is, you know, pure play aerobics. A lot of the classes too have the lights off. I know Barry's is one in particular, and there's a couple others. And I find it's not like completely dark. It's got like these like red lighting, but it just helps you kind of focus in and narrow in more. Cause I think for some people, a class, you know, in the mirror, you can see other people, you might get intimidated or just like kind of feel a little bit self conscious. But when the lights are low and you're just kind of focusing on your run or your movement, I feel like all of that kind of nervous energy goes away. So if you can find one like that, I think Sweat and Tonic also does that too if you're in Toronto. Give that a try, give that a whirl. The other thing could be if you are nervous to try something new, you've never gone to a particular gym or class, take a friend. I feel like that always kind of reduces the pressure. You don't feel so intimidated or by yourself. You're kind of doing it with somebody. Even if you're both new, to kind of have a buddy there is really helpful. And then the last suggestion I have too is, even if you do want to go to a, you know, big box gym, hire a coach, like a personal trainer, for maybe even just like one or two sessions. Because what that will do is help you figure out what the machines are. They'll show you how to set up, how to do the proper movements, how to do the right exercises. And if you've never used some of those larger machines, or you've never really used a squat rack before, having someone there to show you proper form, how to set up properly, how to take the weights down properly, where everything goes, it's just like gonna take so much of the stress off of that. If you're the type of person who's like, I don't want to look stupid, so I'm just not going to do it at all, have someone there. Or even like if you have a friend who's like a big gym bro or gym rat who can help you with that, doing it a few times with someone who is really comfortable and really familiar in that space is such a great way to just get yourself in that habit of knowing where things go, how to set up the proper movement before you do it on your own. Yeah, I think at the end of the day, any movement is better than no movement. I think everyone has their own strengths, abilities, all of that. So do what you can, try what interests you. But I think really the message is just to fill your cup, look after yourselves, and in all the ways that could be really beneficial for your body. That comment today about bone density with Maddie really stuck with me because it just reminded me how little this is going to sound so bad, but how little the actual like body benefits or health benefits were sold to me as a young woman that I didn't even think about in my early life and even more recently. And it's things that are just so important that going into this space, trying something new, putting yourself out there to only reap benefits. It's just such a good idea. So I'm just encouraging everyone today to step into that. 2024, the year of trying new things. So give it a whirl if strength training is new to you. All right. Thanks, everybody. I'll see you next week.